Good morning. My name is Tony Fleo, and I have the privilege of serving as the CEO of Social Venture Partners Dallas. Social Venture Partners Dallas is an organization of engaged philanthropists, men and women who join our organization to give their time, their business consulting as pro bono services to social enterprises, and their financial resources to build the capacity of organizations that work on the front lines of service to our community. Last week or so, we started this series with hearing from our foundation leaders, major foundations in Dallas, on the impact that they're having in their work and working together. Today, we are going to hear from our city council representatives and from community leaders as we work together across sectors to have the greatest impact that we possibly can. As you know, we are in really uncharted waters, and so many of our leaders are stepping up and doing great things on the fly. And we appreciate the innovation, the resourcefulness, the tenacity that our leadership is showing. We would like you to stay engaged with us, and so if you want to use any social media channel and use the hashtag #DallasResponds to help us spread the word on all the great things that are happening in Dallas, we appreciate that. There are many great funds to contribute to answer the needs of the most marginalized and folks who are in the greatest need. And those can be accessed through many of the foundations and through the United Way of Dallas. Social Venture Partners has started an impact fund, which you can reach at impactfund.svpdallas.org. That fund is set aside specifically for the purpose of helping entrepreneurs, those men and women who are trying to bring some great dream to life here in Dallas. And we want to make sure that those dreams become reality because we need them more than ever. It is my privilege to welcome Adam Magoo, who serves as the city council member, serves as a servant leader, a great community member, and we are proud of the service that he has done for our community. He is Deputy Mayor Pro Tem of Dallas City Council. We are pleased to welcome the Honorable Jennifer Staubach Gates, who is a City Council member. We are pleased to welcome Liz Cedillo Perea, Chief of Equity and Inclusion at the City of Dallas, and a phenomenal community leader, Dr. Froswa Drew, who is the VP of Community Affairs and Strategic Alliances for the State Fair of Texas. We welcome this distinguished panel. I am so grateful to you for saying yes to this work and being here with us today. Before I begin, I would like to thank the City of Dallas. I would like to thank all of those who are working as city staff, those who are representing us as elected officials. It has been the distinct pleasure of Social Venture Partners over these many years to work with various city council members, to work with great staff. Last year, the City of Dallas co-sponsored with us our annual conference called Big Bang, where we focused on equity and inclusion and the needs for these things in our community, and how to expand opportunity and prosperity for all of our citizens. The City of Dallas has played a major role in helping us, and we are delighted to have that ongoing relationship. Adam, I would like to throw the first question to you. Are you able? I don't see Adam at the moment. Is Adam with us?
I'm here with you.
Okay, great. Adam, I'm going to ask you to give us all a civics lesson real quick. And if you don't mind, telling us a little bit about just the difference in the roles of the county and the city, and talk to us about the work that you're doing that you were not doing before this crisis. So if you would give us that little civics lesson real quick.
Well, good morning. And Tony, thank you. Thank SVP for hosting this. And thank you for the way you always step up to be a collaborator and to bring people together in times of normalcy and in times of extraordinary times, which is certainly where we are right now. Generally, the way this works is at the top of the food chain is the governor. He gets to adopt rules and has the authority that kind of overlays the rest of the cities and counties across the state. Just yesterday, we saw the governor step in and issue some orders that actually took some of the authority back from the city and counties and provide a cohesive guidance and defined what essential services are and took some other steps in that regard. Most of what he did aligned with what we've already been doing in Dallas County. As the authority flows down, it then comes between the county and the city. The Dallas County, through an agreement with the city of Dallas, is the health authority. So we are reliant upon Dallas County as it relates to certainly running Parkland and having the health authority, who is Dr. Wong, to do the analysis, do the work, and provide us with the data. It's sort of a co-equal branch between the city and the county. And there are certain areas where, as we've seen over the last few weeks, the county has issued an order and then the city has come alongside and issued a very similar order, in some cases asking for more prohibitions or more data, more information from the testing sites. But really working together is the primary way that works. I know Chairman Gates and I both were intricately involved when Ebola was here in the city of Dallas. And that's really where we learned a lot of these processes, is how to work together, how to coexist and to communicate in an effective way so that we end up moving all in the same direction as opposed to in other areas. So the authority kind of rests with that collaboration between the city and county, and with the health authority being on the county side and with the city of Dallas, you know, we're responsible for a lot of the enforcement as it relates to our code compliance, Dallas Police Department, Dallas Fire Rescue, those issues on the city side. So it's a tangled web, but at the end of the day, when we're all working together, which is what we have been, there's always frustrations and, you know, wanting more information or wanting more specific maps and trying to inform our constituents. There's always going to be some of those issues, but at the end of the day, we're working together. And what we've seen is the orders that we've issued in the city of Dallas with our mayor and Dallas County have been kind of a guide for what they're doing in other areas of the state, and now all the way up to the governor's office.
Thank you, Adam. And just a quick personal question. I know that you and Lacey have 3 young sons there. How's the homeschooling going these days?
They just checked into their second class this morning. I keep looking this way because they're right through that door. I had to close the door and say, all right, volume's down on computers and laptops. I don't want to interrupt our talk this morning, but it's a very interesting time for the kids. You get to watch them kind of go through phases. It's just different for everybody, and certainly they're missing the social interaction as well, even though we are doing some video chats and things like that.
Well, we know you are extremely busy, and we are grateful that you've taken the time to be with us this morning. Jennifer, I'm going to throw it to you, given the your experience in healthcare and what you went through with the Ebola crisis in Dallas. Did that prepare you for helping out in this circumstance? What are the parallels? It seemed like Dallas handled that crisis so incredibly well, and I just wondered how you're thinking about it comparing then to now.
There are a lot. Well, welcome everybody, and thank you for hosting, Tony. There are parallels. The big difference is the disease itself, the virus. Ebola was transmitted in a different fashion, and it became more communicable, or it could spread at later stages of the disease. So the structure in place, like Adam spoke about, the county being the health authority, and the city providing the first responders, and the way we react to any type of health crisis, that model is in place, and we learned a lot about how to deploy that model and how to make it work for everybody during the Ebola crisis. But because of the virus and the differences in the viruses, we have to attack this in a really different manner. This is spread within the community, and Ebola really was never much of a threat within the community. It became dangerous to the healthcare providers, but the way we handle medicine here, people were being treated at Ebola when they could spread the disease in a hospital, not in the community. And this, disease, this virus is one, there's still a lot of unknowns. I mean, we see the health professionals every day on the news, Dr. Fauci and many others, just still a little bit perplexed. And that we know we're hearing, 20% of the people that have it probably don't exhibit any signs. So they're out there, innocently transmitting it potentially in our community. So that's why it's important for everybody. They can play a part and to stay home. There's people that don't even know they have it that do. So this is, the effort is just, obviously it's magnified greatly, the amount of cases, but our response is going to have to be similar, and that's that collaboration and sharing resources and communicating but this is going to take everybody to do their part. I mean, it's the biggest challenge I think we'll ever be up for as a city and a county is, can we get through this with the best mortality rate, morbidity rate, the lowest number of lives lost. And that's how we'll be able to see if we have, any type of a victory here.
Jennifer, are you hearing from our local first responders? Do they feel like they have enough supplies and enough equipment to rise to the occasion here in Dallas?
No, unfortunately, I don't think we have a full understanding of what the burn rate is, how many of the PPEs we're going through, because that number changes. Right now, we have the supplies, but I think this is nationwide. We're seeing a shortage of the PPEs, and we are going to have to continually, get a hold of that. Understand, this. The mobile medical unit that we're going to be setting up, the Kay Bailey Hutchison Center, and then the other hospitals, our first responders, what are we going through? And then how can we plan for the future? So.
Thank you. Liz, I'd like you to take a moment and, as part of the city staff, to which the citizens are very grateful for all of the hard work that our city staff is doing on our behalf, tell us a little bit about your office and the role that your office plays. Social Venture Partners is very interested in equity and justice and meeting the needs of communities that are typically very under-resourced. And so we wonder how your office is interfacing with those folks now and what you all are doing from your perspective.
Thank you, Tony, and good morning, everybody on the line, and to my fellow panelists. It really is wonderful to be a part of this, and I thank SVP for being an ongoing collaborator with us at the city to do all of this good and to get the word out and to keep us connected, even if it is spatially. And it is lovely, it's wonderful to have Ms. Gates on the council, a healthcare professional who can guide this effort and be with the chair of this new ad hoc committee that I'm sure he'll talk about in a minute, Mr. Magoo, who had the coined phrase all in for D10 long before we all had to be in. And so now we're all in the city, and to be with Dr. Froswa, who is just doing amazing things to align our community nonprofits with the resources they need to serve those most in need, the vulnerable of our community. And that is certainly what the mission of our departments. It's a group of 6 offices that are very thinly staffed, but I call them a very strong team and spirit, because we are working to live out those 4, is what we call them at the city, 4 E's, our values of service, and certainly one of them being equity in providing fair and impartial services to all of our Dallas residents so that we can see that outcomes improve for all. And so no greater time during this moment when we know that so many people are being impacted across the board. But certainly those most vulnerable, those people who are our everyday heroes that I see now differently even than a couple of days ago or a week ago, those people who are serving us at the grocery stores or through drive-through deliveries, through people who are caring for lawns or constructing buildings. Those are the people that we're trying to keep in mind when we're thinking about how are we best serving those people so that they aren't as impacted as traumatically as could be possible if we don't work with intentionality and certainly we're doing that to the extent that it's possible. I never knew that we could do so much through vis-a-vis technology. So I'm very proud that we are working through Microsoft Teams and through Facebook and through, not Facebook, through FaceTime, business, and all the other tools that the city has available so that we can really meet those needs. And I'm happy to go into a few of them, but I'll give space for the other panelists to weigh in on this as well.
Thank you. Froswa, it's so wonderful to have you with us. You are an amazing leader in our city. Congratulations on the recent publication of your book. That is so exciting to have you with us as a newly published author. Tell us a little bit about the work of the State Fair of Texas and your role in what you're doing now these days for the community.
So I serve as Vice President of Community Affairs for the State Fair of Texas. And so I am responsible for an amazing team, very small, but just incredible. And we are responsible for the philanthropy, so the giving of the State Fair of Texas. And we focus on 3 zip codes, 75210, 215, and 228. So pretty much a circle around the State Fair. And we really look at 3 areas. It's capacity building for nonprofits, it is economic development, and then it's education. And so in addition to the philanthropy, we do a number of signature programs. For instance, we have a cohort for folks who want to be vendors, food vendors at the fair, and we really help them build their capacity where they're ultimately able to shadow concessionaires, and one of them actually ended up having a booth this year who graduated from the program this past year. So that's just one of the many programs that we do. But right now, we really have been focused and engaged on looking at our nonprofits in the South Dallas, Fair Park, and Southern sector, and making sure that they have resources. We had put together a resource guide that's on our website, and we've done an app that has resources. But in this time, what I noticed was a lot of the smaller nonprofits were not on the radar of funders. And I was blessed that Councilman Magoo asked me to be a part of the one of the response teams that the city has. And what I wanted to make sure of was that we had a list of these small nonprofits. And I am so fortunate because I get a chance through my work with United Way and our capacity building cohort that we have, and we're doing a new one now that focuses on nonprofits that are in the reentry space. But I get a chance to see a lot of these small grassroots nonprofits. And I was fearful that when we have disasters, what typically happens is these nonprofits are not on the radar. Although they're doing all the work, they really don't get the resources that they need or the visibility and the attention. So I wanted to put together a list, and I know by no means it is the most comprehensive. It's not. It's growing and evolving. We actually have a group of developers who overnight put together a website called servedfw.org, which is a way for us to put these nonprofits out there. But in addition to folks knowing where services were located, I noticed that nonprofits weren't talking to each other. So on Monday, I did a Zoom call with a small group of our nonprofits in the South Dallas area, and it was amazing listening to them talk about what they were doing, and noticing that one group talked about they had a diaper drive, and the problem is that they noticed 2 populations were emerging in needing services. It was the low-income population that's always been there, but has even more need now. But there's a new population of folks who have resource, but because they can't find diapers and find food that they need, they're now showing up to these events. And so it was great to get this information to be able to help them. But what happened was they started collaborating. And so at the fair, we spend a lot of time building social capital of our nonprofits. We do something called Community Engagement Day, where we bring nonprofits together and not necessarily talk about money, because that's always what everybody says. And what I've discovered is really the issue is they need relationships. And so what we try to do is get them together in a room and have them talk to each other. And we've been doing this for a number of years to get them to build their network so that when situations like this happen, there's a safety net in the relationships and they're able to now support each other with resources. And so we've been really trying at the fair to make sure that in addition to some of the funding that we provide to nonprofits, we're really trying to build these safety nets through building their social capital.
That's fantastic. Thank you. Adam, talk to us a little bit about the ad hoc committee and what you all are focusing on and how it brings communities and different organizations together.
Well, thank you. I just, first, the observation of just these three amazing, strong women that are leading in this city and through this, I'm just always impressed. And that gets really to the point of when the mayor decided to pick two committees, he picked one that's going to focus on the economic development side of this. And he stated as that this is trying to help the businesses and small businesses not shutter, and then help them recover as quickly as they can as we move through and hopefully pass this this time we're in. And then he said everything else as it relates to serving people, mitigating impact, monitoring compliance, and preparing for recovery comes under the umbrella of our ad hoc committee on human services and assistance. And so it's a weighty task, but what we did is we focused on the strengths of the people on the committee, and we have some amazing leaders in this city. People that have, like Chairwoman Gates, who has experience in the health industry, has relationships and connections, have been through episodes like this in the past, and can just take the ball and be a leader immediately in some of these areas. We're blessed to have Jaime Resendez, who has been on the Dallas Independent School Board as a trustee, who can lead in that area and deal with a lot of the youth services and work with our independent school districts across the city. We have Omar Narvaez, who's been engaged with our elder population. And as we start seeing clustering sites in some of the elder care facilities, we had the foresight to start focusing on some of these issues early on to address those needs. It's a constant battle to try to make sure we're trying to put the resource with the need and do so effectively. And at the same time, as I said so from the beginning of the work in our committee, to get out of the way too. As Froswa mentioned, there are so many organizations and groups out there that are doing great work. We just want to leverage and come alongside what they're doing, not try to overlap or pull into where you're taking credit or something like that. We are truly all in this together, and we work best when we're able to leverage each other. And so on our committee, we've got some amazing leaders on the city council side that already had some experience in these areas, and we're trying to use that to work with our private partners, our corporate partners, the nonprofits in the community, and then focusing and prioritizing the highest needs with the resource that we can get a hold of. And it's a weighty issue. I mean, it keeps me up at night. A lot of these things we take on ourselves. We see the impact in some areas spreading. We also see areas where the curve is already flattening. And so we know that some of the work that we're doing is having a positive impact. And so I'm thankful to be in a role like this where you have such direct impact, but it's also, there's a lot of pressure on making sure we don't miss any opportunities to serve.
Adam, I know that every institution of any kind, business, government, nonprofit, whatever the sector is, we are all struggling with how to meet the immediate needs today, and then how to think long term and plan for a future that will never be the same. And I'm wondering if you think that the city council is making this paradigm shift. Do you think that the city council understands that that it is never going to be the same, and the same rules that applied to things that we were thinking about just a few months ago or in the last budget cycle have to be thought about differently? We do understand that there are systems at play. Some of those systems hurt various communities intentionally. Most of us walk around without even understanding how that happens. The paradigm shift is real. It has to be there. Do you think there's still denial about how and what we should be funding? And do you think it will all shift because we now know the importance of funding human interests, community-based programs, all of those things that might not have been a priority in the past? What are you thinking about that?
It's a great question. My answer is really all the above. In some areas, I think we're starting to get there and see it and understand it. And in others, not yet. I don't think it's still so new with some of these changes. But you just simply look at the assistance that's coming out, even the federal government right now, and we start looking at ways to help and protect tenants that are dealing with situations where they're not able to work and facing potential issues with evictions, and we're taking that item up through our committee as well. There's a lot of things like that, but then you think about the other populations that are in our community that aren't getting the information in the same way that even we are. You think about our undocumented neighbors who are not going to get the same benefit checks if they didn't file tax returns before. So there's a lot of populations and needs out there that are, even the systems where we're trying to bring assistance to as many people as we can aren't equipped to deal with. And so that new norm is going to continue to be developing. And it's one of the things that I when I got up this morning and thinking about this call, I was optimistic, because we do have so many in Dallas that are innovative, that are creative, that see problems as opportunities to resolve. And you start seeing that already, whether it's SVP focusing on entrepreneurship. There's a number of mentorship groups out there. We've had private businesses that have totally shifted their model already just in weeks to start providing needs in certain areas. So I'm very optimistic we're going to get through this. But what you talk about with some of the changing systems, you know, just in the conversations we're still having at council right now, it still feels like we haven't quite totally reached the recognition of how the new normal is going to be. And there's really no way to, because we don't know that extent yet. And I mean, the hope is that we can get a lot of this stuff behind us quickly, but that's still yet to be determined.
Thank you. Jennifer, I'd like you to chime in on that too. And your district was hit really hard by the tornado. It probably feels to you like you're managing one crisis after another. Do you think that the council has had a paradigm shift in regards to the kinds of priorities and funding we have to have for in advance to prevent some of these, to be prepared for some of these kinds of needs that the city faces? What's your take on all of that?
You have to be flexible, and you have to be able to respond appropriately to kind of the emergency at hand. And you're exactly right. The things I thought I would be tackling my last term with, have totally flipped. And it was started with the tornado on October 20th. And I thought, this is going to be the focus. We're going to have to rebuild. There's going to be some opportunities in some commercial areas to do things differently and possibly better. And then there was, those that, just wading through all that emergency and all the different needs that were apparent. And then it's quickly shifted now to this emergency. And that's where I think it has, when I drive around, and over the weekend I had the opportunity, the weather was beautiful, and I, went on a big bike ride that in areas that I typically are, now that actually the streets you can actually bike safely on. Everybody's worried about the trails. I'm like, look, our streets are empty, so you can get out and move around, and to see that, the effects of the tornado are still prevalent in my community. And then to have this layer on top of it. And we know that potential funds that we were looking at, that maybe FEMA helping us, are not going to be there now. We're going to still, try to appeal those decisions, but I know there's greater needs at this point, I'm sure, is how the federal government is looking at it. And so we're going to have to, that recovery is going to take longer than we had anticipated, and we're going to have to look for different economic tools to be able to rebuild in areas and get the help to our residents that are needed. So, and that's been a huge role, is just communicating those opportunities, if it's with the small business loans, or how to seek for the unemployment. We've done a lot of connecting, and we're going to have to continue to play that role. And then we're going to have to, when this is over, figure out, okay, then how can Dallas, how can we, are there policies or things that we can change here to help people, rebuild their lives?
Absolutely. Thank you. Liz, from a policy perspective and a staff perspective, your office has been dealing with issues of inequality for a long time. Talk to us about what message you'd like to get out there. What is the priority for the city staff and the various departments? This, in a sense, is a moment in time when your voices can be heard in ways that probably was not heard before. So from your perspective, what is the message? What's the priorities? What do you think City Council and the citizens need to know about how we move forward and where we should be putting our emphasis, our time, and our resources?
Oh, thanks for that question, Tony. And in this moment, I think we're all looking at it from a critical needs perspective at this moment. So looking at what are the top 4 or 5 needs that we can align with everybody in the city to, as Mr. Magoo noted, not overlap or bump into one another, but be in seamless coordination about how we can be most impactful to our communities writ large. And then being very intentional, as I said before, about addressing the needs of those who are most vulnerable, our seniors, our children, those people who are living paycheck to paycheck, those people who was noted who are working but in building our economy, but are not going to be accessible or to the federal relief programs necessarily. There is one that I did want to highlight that is available, and it's a pretty broad and inclusive program that's made to get small businesses beyond this critical time so that employers and employees can remain attached. And that's the Paycheck Protection Loan, which is really sort of a misnomer because it's not a loan as long as you stay in business and you use it to protect your payroll. So it's for people who are already registered and licensed as a business. So people who are W-9s or working on contract can also be eligible. So it's not necessarily for only those people who are citizens. So I wanted to highlight that out there and highlight the work of not the committee that I'm aligned with through Mr. Magoo's ad hoc committee, but the Economic Recovery Committee is addressing these needs to stabilize our economy. But it's all interconnected, as he noted, when we're looking at housing stability and cash in hand and internet access and connectivity with people who are already feeling isolated. That's where we're trying to directly build momentum around, amplify people's voices. We're starting a social media messaging today that we're all in this together. If you follow us at our Resilient Dallas website, social media handle on Twitter, it's at ResilDal. And hopefully we can be on the same page about, it's at Resilient Dal, capital D-A-L. And then connect with us so we can see how we might be able to be supportive of the creative, innovative programs that are going on in the city.
Thank you. First of all, when you hear that we're all in this together, there are parts of the city that have felt intentionally left out of being together for many years in the city. What do we say to communities that have been marginalized for a long time, and we say, okay, now we're all in this together, and they're like, yeah, well, where were you 20 years ago, or where were you 50 years ago, or where were you last month? How do we kind of bring that conversation about in a real way that says, yeah, this time we recognize that this is true. There is a universality to what we all share, what we all suffer. And the sooner we learn that, the better off we all are. How do you respond to that in what you're hearing in your community?
It's absolutely true. I think we have to own this. It is one of those things that the city, all of us have got to own the responsibility of not being there. And for policies, and this goes, beyond the city of Dallas. It's even federal. It's the policies, it's the systems that have been in place that have allowed people to be in the conditions that they've been. And so I appreciate the panel and the folks that you have here, because I know personally what they're doing to try to rectify and make things better for people. And so I'm grateful for seeing those things happen. I think it's going to be important for us to think about the barriers that we create for those communities, even from a funding standpoint. I think we have to be very careful about always looking at those organizations who are huge, and no disrespect to them, but they're huge and they have resources and they have people on their teams that can do R&D and that are able to articulate their message. And whereas you have these smaller nonprofits that are on the ground that are doing the work, and we penalize them because they may not have those things in place. And so I think it's going to be important in this season to recognize that and to make sure that we are applying an equity lens and knowing that there's been a disadvantage for people to be able to compete. And they don't have the same resources and tools that other folks have had, not because of intelligence or anything. They haven't had the resources. And so I'm noticing that in our communities, that the challenge is people don't feel that they have access to those resources. I continuously push them to the North Texas Cares Fund. And one of the things that I love is being able to work in partnership with United Way, with you, Tony, and with Communities Foundation, so that we can share those lists of those marginalized organizations who typically aren't on the radar, so that they can have access to these kinds of opportunities. But I'm hoping that in this situation that we have, I see that it is exposing the inequities that exist. And I think it's also exposing our privilege and that we don't pay attention to it. I posted on Facebook that for the first couple of days of the month, don't go to the grocery store. Allow people who get government assistance to go and get products, because what's happening is people are going in, buying up everything. And because of privilege, or we don't know that that's a problem, that when they get there are restrictions on their card. And so they can't buy everything, and what's left over, they can't afford. So it's helping educate people in this season as well. So even with the inequities that exist, I think it's a real opportunity for us to educate people and bring along those entities that have been doing the work in these communities of color, in these marginalized communities, and bringing them along and getting them access to these opportunities so that they can also be in a position to serve their communities, get the funding, and compete.
Thank you, Froswa. Jennifer, I want to throw it to you to comment on that a little bit. You know, there is a sense that we really don't understand how we are all interconnected, how laws form systems, and how these systems have this universe that they play in that really does shape our lives. And we're getting a real glimpse of that in the crisis in the healthcare system. And how does the city, how are you playing with the healthcare system to make it more equitable, to make it more responsive, to help us understand how these things are so critically intertwined? What are you working on these days in that regard?
Well, one, we know this disease, you know, it doesn't discriminate. This virus is throughout our community, and everybody's at risk. And so we need to make sure that everybody has that kind of access to testing. And we've deployed, you know, the testing sites currently. But we will be getting to a point where we're going to have to work on that constantly, is that as we making sure that we have the available tests needed and that they're deployed throughout our city in an equitable fashion, and that everybody can have access. So we understand, and I mean, we're getting to a point where you have a community spread and you can't do containment anymore, but you need to understand, are there pockets where you're seeing more prevalence or not, and the way you respond. And then we're gonna, you know, we're working on the understanding, the mayor's put in his orders that the hospitals have to report their capacity. And so right now we have, or as of yesterday, we have 8 hospitals that are reporting. So we need to make sure that there's beds, and the beds are going to be available to everyone. And those healthcare decisions are really made when somebody is in the hospital setting and that needs. I mean, they're made very equitable, and there's a, you know, ethics and place, and it's policy in place that determines, you know, by need and by their medical need, that who's going to be served. So I mean, I think the medical profession, you know, is one that you know, it is all, the decisions that are made are based on medicine and not by your monetary opportunities when in the case of, you know, an emergency. So, you know, we're working hard. It's really hard. It's, you know, this virus, you know, we can look at areas, you can look at what's happening in New York right now and try to, you know, determine, is that going to happen here? Are we going to have the same kind of surges? And by looking at these modeling that's occurring, and, you know, there's a lot of difference of opinion on how it's going to how it's going to surge through Texas. But we're trying to be prepared and trying to understand where those resources are, and making sure that there is going to be adequate resources for everybody.
Thank you. Adam, is the city leadership in conversation with other cities in countries that maybe are a couple of weeks ahead of us? Is there any conversation about lessons learned, and are we trying to stay ahead of the game, or is Dallas pretty isolated in terms of just making its own decisions, doing it based on what's happening here? Or is there ongoing conversation among cities about what are the best responses?
Yes, sir. I mean, there are lots of conversations, lots of coordination, lots of interaction. You see almost daily, well, multiple calls a day. There's calls with just the county and local mayors. There's calls with the mayors across the state. There's calls with the governors and all the way up to the president. So there's lots of interaction with other cities' leadership in our own country, and everybody's trying to track and see how we flatten the curve in each area. And some of these same conversations are happening with sister cities and others that are highly impacted in hotspots across the globe. So there's no lack of communication. There is a difference between how you respond proactively and reactively, and that's one of the things that I've been kind of watching, how we're still in a place where we're having to respond to crisis, not really being able to be so proactive. Although things that we've done here in Dallas, like setting up the Kay Bailey Hutchinson Center, and like we've done in the philanthropic community about organizing very early and looking at some of those needs, is huge. But there's just I was just thinking in your previous question, walking into Chipotle a couple of days ago trying to get something to eat, and anybody who thinks that we're not connected to every single other person in our community, is this more than ever has shown a light on what that is. It's the person that walks in behind you and you're like, are you going to stay 6 feet back from me? Are you going to get too close? What that looks like? Or when you have the person that's cooking behind the counter and they sneeze, wait, are they going to wash their hands immediately? Like, every single one of us is connected to each other in such a in some cases dangerous, and in some cases a beautiful way. And so recognizing that through this experience should influence our leadership and the decisions and things we make on a daily basis moving forward. And so I'm encouraged in that regard. Can we hold on to that, and can we continue this through this time? I hope we will.
Yeah, I appreciate you saying that. In our last few minutes, I'd like to ask everyone to respond to, and you started to hit on that a little bit, but respond to the question, how has this changed your thinking, and how has this changed the way you will govern in the future?
So the simplest or quickest answer that I feel in that moment is, I'm a mediator by trade. What I do when we have highly complex situations and issues is my go-to is always to get everybody in the same room. And when we have big problems, it's let's get everybody in the same room, let's talk about it. When we first got these committees, I called Froswa, I called others. I wanted us to get all in the same room. And while we're using technology and we're trying to do that, it's not the same. It doesn't have the same connectivity through our technology that, as I also teach mediation, and I've resisted going to an online platform because so much needs to take place in the human and social interaction. And so I think the way this is impacting, I haven't got complete understanding of it yet, but I think as we continue through this, we're going to see all sorts of changes on how we interact with some kinds of conversations and how we dedicate that personal interaction to others. And just as a leadership technique, I've recognized that what I find a lot of pride or value in is this idea of being forethinking, of being proactive, of looking at that next step and figuring out how we get there and make things happen. And right now we are just so reactive. I've been in a lot of meetings where I've asked the question to other leadership, okay, whether we're talking about police and fire issues, right now we have different circumstances. How can we leverage the circumstance where we have a bunch of people at home right now and use that to establish things that are going to be helpful when things change back a little bit. So still trying to incorporate that proactivity into some of the leadership. There's a lot changing right now. It's impacting all of us very differently. Even our own physiology. I think there's moments during the day where I have energy, I'm going, I'm working, and then I get a lethargic point, and it's kind of like just trying to push through. And so it's impacting all of us on a daily basis. And I'm again encouraged by some of the revelations, and I think we're going to end up better at the end of this.
Thank you, Adam. Froswa, how has it changed your thinking, or has it?
You know, I am like Adam. I'm a relational leader. You know, my research is on social capital. My life is just how do we build relationships to make things better. For me, it's made me think about well-being in a very different way. You know, I see these nonprofit leaders who are doing very great work, and I think as much as we're concerned about the virus, I don't know if we're paying attention to mental health as well. And so it is really making me think about the totality of people and not just the services that they can provide for others, but how do we make sure we're taking care of people well and creating these spaces for people to share. And it's making me think about how do you really incorporate that in the work that you do, because we expect folks to show up and do this amazing work for others, but I don't know if we have things in place to take care of the people that are serving, whether that's on the healthcare side and watching nurses who are, you know, dealing with the trauma of seeing people, and lots of people come in that condition, or our nonprofit people who are having to try to figure out support. And thinking about, you've got people that are in nonprofits who don't have healthcare, that they're having to go to the same clinics that their clients are going to. And so I think it's going to require us to really apply a systems thinking approach to this work. And for me, it's helping not only think about the well-being, but it's helping me think about advocacy. You know, we've been doing some things, and I won't go into it, to really advocate for our community, but I think this is really an opportunity for nonprofits to think about advocacy in a different way. And how do they not only articulate their message, but advocate for the entire community of nonprofits. And even though you have the National Nonprofit Council that's doing great work locally, we've got to do, in my opinion, a better job of how we advocate for one another, so that we're not just advocating on behalf of our clients, but we're advocating on behalf of the industry and making sure that our leaders are well and that people are safe and healthy, and that nonprofit executives aren't having to go to you know, they can't go to a clinic because they don't have insurance. That for me is really what's making me think differently about how do we care for the people in our industry better than we have.
Thank you. Liz, how about you? How has your thinking changed, and how will you manage your teams and your departments differently going forward?
Well, like the two previous speakers, I think I'm drawing more on my experience, my professional background. Spent most of my professional career as an advocate attorney for what could be deemed the little guy or the little gal, and that's what has motivated me and continues to motivate me, because I'm from a family of little guys and gals, and I came from a high school where we were considered an underdog. And I keep my North Dallas High School mug on my desk right now, because I just want to remember my fighting bulldog spirit, because it's going to take that type of spirit to move through this. But the bulldog spirit is also one based in love and concern for our neighbors. So I think that, you know, using my lived experience and my professional background to bring whatever I have at this moment to the table is how I'm trying to be mindful and to lean on others, because everybody has this talent, what my mom called a dawn. Everybody has their own dawn that we can use and we can bring to the table. So I don't know how many people are out there listening today or hearing this, but bring your dawn to the table and connect with us and see how we might be able to work together so that we can get through this with the least amount of trauma to our community, and that we come out of it more resilient and more equitable in how we love one another and treating one another. And I just wanted to point out a clip that I know Rosalind Thompson last week used about it. When you stay in your lane, there's no traffic. read one last night from George Mason, Pastor George Mason, and he said, fear moves us away from people while love moves us to them. And so that's really resonates with me, and I hope it resonates out there so that we can work more closely and together with less guard for one another.
Thank you, Liz. Jennifer, how about you?
Well, I think this has been incredibly challenging times for all leaders. We're relying on, usually we make decisions on really good data, data driven, and you can analyze and understand why you're making a decision or a policy. And this is, everything changes every single day. And we're having to rely on the medical professionals and the real science to make these decisions. And sometimes it doesn't feel right. The separation is we know the tolls it takes on the community and the isolation, but it really is necessary. And I think we realize that everybody can play a big part. And I know people might not feel that way, but staying home and really abiding by these regulations, and I think the kind of the soul searching of what's needed and what's wanted. I mean, I think we've all, I can remember watching the way my grandmother made choices, and anybody that lived through the Depression. And I think we will all think differently after this experience. And I think those are, and there will be, and we're going to see a lot of, somebody told in one of the first few days, I heard something kind of haunting, like families will look different. And we're going to, I've known people that have been ill, and I've known people that have come, are recovering from COVID, but almost lost their lives. But we're probably all going to know somebody, and not just, the famous people that we've heard and read about it in the paper, but it's going to affect these numbers that we're hearing out of the White House are large numbers, and it's going to, and the idea for me, and I guess I go back to my nursing days, and when people are sick, I think one of the most, the toughest stories to watch are that people are dying alone. And we're not going to, that's out of protection. You can't let, family members, and a lot of their family members are positive, so they can't be in the hospitals. So these are just really challenging times that I think are going to stay with us. And I think the way we make decisions, putting people's health first, which we've done in this situation, over the economy. And I know there's a lot of debate about it, but I think we will make those kind of decisions moving forward, and really appreciate why it's important to remain healthy as a community. Maybe we'll see better health care. This isn't something that actually you probably could take care of yourself. And it is, because people with underlying medical conditions are more vulnerable. So, if there's a silver lining, that if we could improve the delivery of our healthcare system, because I do think we have chosen, the political leaders and all of us have chosen that we're going to put America's health, and here in Dallas, we're going to put Dallas residents' health first right now, and we're going to make decisions that are really challenging and really difficult to save lives. And I think that has resonated with me, and that is something I've always felt was we needed to do, but I don't know if we have done it, and maybe we'll value other decisions moving forward for the health of our community.
It is really an extraordinary time when we think about that we've actually put people first over economics, and it is an extraordinary example of what can happen when we do that, and we do that with intentionality, and we do it together. Jennifer, other than asking the citizens of Dallas to stay home through this period, what other requests would you have for the citizens?
Well, this is, we're going to see rises in both child abuse and domestic violence. So, and one of the we're not necessarily seeing more calls because people are, sheltering in place with the offenders. So if you see something, say something. If you hear something, say something. And especially, in areas, it might be hard in single family homes. You might not be able to see that abuse happening, but you might hear it in apartment complexes or, and we need to make sure that we're making those calls for people that can't call for themselves. So that's a message, right now, and I encourage those that are in situations, if they have the opportunity, to get some resources online. I know the Family Place is starting a program about how to de-escalate. I think even in normal, healthy relationships right now, we're all under a lot of stress. And it's we need to, work on your own mental health. And there are a lot of opportunities online. And I try to share what we get through our office for people and resources that people can, work on their home life relationships during this stressful time. And that's normal. I mean, when everybody deals with stress differently, and we have a lot of economic stress right now, and, cooped up stress, and, we're doing things that we haven't done as, parents homeschooling. So, taking care of your own mental health, and praising and supporting the healthcare providers. There are real heroes right now. And I know there's a lot of family members, that are having to, live their lives differently because of the healthcare providers in their lives. So, if you can help a neighbor, help a healthcare provider, and there's ways to volunteer online. But, it's the time to be selfless right now, and really do what you can for your, fellow Dallasites, in the sense that, and while you're still social distancing and staying home, there's opportunities.
Thank you, Jennifer. And thank you to each of the panelists for joining us. I know that, as Jennifer said, it is very stressful times, and we're all inundated with major responsibilities and major asks for us. And so thank you for the generosity of your spirit and your time, your public service that you give. There is a saying that cities, are a place where people come for protection. In the Greek, that was how cities got formed, that they came together so that they could be inside the walls, and those walls protected them. And we understand that it's not brick and mortar walls anymore that protect us. It is still coming together. It is science, it is data, it is us all working together that provides that protection. And it is said that, cities get built out of the dreams of poets. And probably for many of us, this is the first time that we have the opportunity to sit back and we have hours of moments of reflection and opportunity to figure out how we can add to the poetry of our city once we come on the other side of this. That each of us has an opportunity to step up and to create a new reality for Dallas, a city that we have, many of us, worked very hard to make happen, that we have dreamed about. And the momentum that we all share together right now at this moment in time is a momentum that can help us achieve a much more equitable and a much more sustainable city for all of our residents and all of our citizens. So I ask that our audience, and there are many, many of you, and we are very grateful for you tuning in. I ask that you continue to stick with us. We will do more of these sessions because the response has been so overwhelmingly positive to them. We are looking to do one on mental health soon. We are looking to do more and more of these so that we can respond from the different sectors and hear from the leaders of our community. I ask that you check out our website at Social Venture Partners Dallas, support our work, support our fund, support the funds that are set up by the other organizations in town. But most importantly, I ask, as everyone does, that we do what we can do for the community, and it is simply staying at home, but also using technology to reach out to our neighbors, to make sacrificial contributions to help one another, and to be together as we move forward through this will be the most positive thing that we can do. I want to thank the men and women who make up Social Venture Partners. It is your dedication, your support that allows all of these kinds of things to be possible for our city. So once again, thank you to the outstanding leadership that our city is providing, to our panelists, and to all of you who've tuned in because you want to know and you want to be better citizens here in Dallas. And we look forward to having that dream community as we go forward. So thanks again, everybody. And we look forward to being with you for our next one, which will be in a week or so. Appreciate all of your time and the talent and the resources that you bring to make Dallas a better place. Thank you.